Retention of an abutment connector really is two-phase. One is the retention itself per se. The other is the stabilization for that retention. And retention is either with screws in most implant systems or a locking taper unique to the Bicon implant system. Stabilization of the connector provides its reliability, i.e. if it's not stable, it's going to loosen. And there are different ways of stabilizing a connector. One is with a hex, whether it's internal or external, and I'm using hex in a generic way. There are hex by design, but there are also hex analogs, that is various shapes, either external or internal to the implant, that help reduce the movement of the screw or the tendency for the screw to loosen. These hexes or stabilizing devices can be internal or external, but there are also two other types of stabilizing designs. One is the locking taper and the other is the releasing taper. Now the difference between a locking taper and a releasing taper is that a locking taper is less than 4 degrees inclusive. That means that the taper on one side and the taper on the other side added together are called the inclusive taper. And a locking taper has to be less than 4 degrees in order for it to lock into place. A releasing taper, on the other hand, is anything greater than 4 degrees. And actually, a releasing taper acts like a wedge. It is a stabilizing device, but actually needs a screw to prevent the wedge from releasing itself or popping out. One of the ways to look at it is when you tap a wedge into something, it'll actually bounce back. And you really need that screw to help retain the releasing taper, but by the same token, a releasing taper can actually help stabilize the screw. So it's a mechanism that actually works fairly well. On the left-hand side of your screen, you see the locking taper. In the center is a hex implant, an external hex, not an internal hex. And then on the right-hand side of the screen are two releasing taper designs. They all work, but the more reliable attachment mechanism is the locking taper.